Okay, now let's make sure that we bring up our next speaker properly, because he has one of the most unique backgrounds of any speaker I've ever had the pleasure of presenting here. Reese was doing medical imaging research at Berkeley, looking for how schizophrenia works, with a history of studying brain chemistry. Reese's hobby was phone hacking that distracted him to invent how sound and telephone wire strands work for internet today. This led to many tech companies. He helped start Singularity University and recently focused on FDA approval of psychedelics for legal medical research. Reese, will you please come and let's give him a huge round of applause. I'm going to let Reese share his thoughts on the topic. And I'm a little disappointed. We were at TED together, and he was holding a Jeffersonian dinner on the topic. And it's something that I find fascinating personally, because I'm not somebody who does drugs. Right? I was slipped something once when I was at Burning Man. I had a very negative experience. But it's something that I understand that there's a potential value for, and is worth exploring from a medical perspective for the benefit of society, ranging from applications of PTSD to anxiety, stress, anything you could imagine. And Reese has really taken the time to explore this topic, and I thought it would be an interesting conversation for us to participate in. So without further ado, let's give a huge round of applause.
So this is a topic that each of you knows something about, or has some opinion about, or has some experience with, or some fears about, or some beliefs about, and nobody understands it completely. So I want to leave enough time for questions and discussion, and it's okay to be an expert. It's okay to be tripping right now. It's okay to know nothing about it.
We have to bring enough for everybody. It's like third grade.
And so one of the things that I've been working with in the last couple of years is a program to train psychiatrists to have a certificate to do psychotherapy using psychedelics in a standardized way to run enough patients to get FDA approval on adding psychedelics into a psychotherapy process, to get some of these compounds that are recently illegal back to being legal for medical use, and for some specific applications in medicine for FDA approval. And it turns out the bottleneck in doing that is running enough patients or enough people on a standardized procedure with enough control that the results can be proven scientifically, unambiguously. Is this safe or not? Does this work or not? Does it work better than other things? And it's an area of scientific research that's extremely difficult to do in a controlled way, because it deals with modifying our consciousness and modifying things that are subjective, and everything about the experience matters, what's called the set and the setting, and anything can influence it. So if we were doing an experiment at dinner, and those of you who did eat the refried beans, half of you, if you chose the dark ones, would be feeling something right now, and the other half of you would be able to tell which half of you that was. And so it's hard to do an experiment where you have a control of people who are in the same setting that have a different experience, where some are having a mystical visions of God's, speaking to us through the walls, and others are looking around going, why are those other people behaving differently? And why did I choose the beans that I chose? And so the history of this is there's, for millions of years or thousands of years, people and pre-people have been eating plants. And plants affect our consciousness in many different ways. And some plants have natural compounds in them that directly affect our consciousness, and others, molds or fungi grow on them, or they ferment or they change in such a way that, for example, alcohol ferments on grapes and sugars and fruits that then affects the consciousness of the people who eat it later. And humans aren't the only ones who change their consciousness this way. Birds and many animals do this. And so it's something that we all have some level of familiarity with. And the natural response, if you've eaten something and you feel your consciousness changing a little bit, is to go throw up. And that usually it's a sign that whatever you just ate is rotten to the point where it might be toxic. And so the boundary between something that is modifying your consciousness but is not making you so sick that you'll get sicker is a sort of a effectiveness window. But the theory goes that our relationship with plants and our relationship with foods is the thing that differentiated us from other primates, and why we developed larger brains and a different cultural interaction with each other because of the things that we chose to eat, and then those people mating partners that we chose to mate with afterwards rapidly differentiated us into a species different than the other primates that makes heavy use of language and culture and social interaction. And a lot of that involves drugs, which come from plants that have been part of our lifestyle since we were, simpler primates. So the recent history of psychedelics in particular is these were commonly used in lots of cultures around the world, particularly in mushrooms, and became better understood roughly in the 40s. And the most notable one is LSD, which is a chemical modification of a fungus that grows on grains that are part of our diet, or gluten and beer and so
Can I
forth.
ask a quick question about this? So is there some place we could go grab some grain and just get really, like, have similar effects as LSD?
Yeah.
And who here is curious where to find that? Or can supply some to the rest of you?
So the fungus that grows on the grain is an ergot, or makes an ergot, and the ergot is psychoactive, and if you modify it chemically, it becomes LSD, as an example. Another example is mushrooms that grow on cow patties, or the kinds of prey that humans prey upon, large mammals, the kinds of mushrooms that grows on their poop. There's over 200 different species that have psychoactive compounds, usually psilocybin. And so in 1938, Albert Hofmann extracted the compound from the ergot growing on a grain and set it aside in his lab. And for some reason, several years later, on April 19th of 1943, he decided to take it down from the shelf and took a small sample of it in what he thought was might have some effect. He was doing drug research for Sandoz, and we're working on ergotamines to see if they might have some use in psychiatry or cardiovascular medicine. And he took what he thought was a very small dose and rode his bicycle home. And on his bicycle ride home on April 19th of 1943, he had all kinds of hallucinations. that the bricks turned to birds and the colors melted into the buildings and street, and things that we might allow ourselves to think about if we weren't trying to maintain our consciousness and sobriety. We might say, well, the walls of this building might melt, but for our sanity and for our conversation, we're going to assume that they're not going to melt during this. And so he experienced these things happening to him, and thus this day, April 19th, has become known as Bicycle Day in the world of psychedelic chemists. And that was the first discovery of the effects of LSD. And coincidentally, within less than a couple years of that, the Trinity test of the nuclear weapons was first detonated, and that was considered, if you're divine intervention inclined, that our ability to destroy ourselves globally ratcheted up with the deployment of nuclear weapons, and his thought to discover a psychedelic wasn't just a coincidence that it happened at the same time. And the other research on psychedelics and mystical use of plants was happening at that time in South America, all around the equator, with different mushrooms and different vines and other rituals that are the common basis for most religions. The rituals of the religions are very often, could be the right kind of plant, and people would have a shared mystical experience caused by the plant, and you just take out the active ingredient, and thus the procedure of a religion is often related to the experience that people have with psychedelics. So this, another important one is psilocybin, which is the psychoactive compound in mushrooms that the same chemist who synthesized LSD isolated the active compound in the ritualistic mushrooms, and they took it to the shaman who did those experiences for people, and she said that yes, that chemical is the active ingredient and is the same experience as what's in the whole mushroom. So that's psilocybin, LSD. These things cause you to question reality and question the status quo. And this, during the 60s, caused kind of a cultural disruption, and people questioning the government. And around that time, the government decided to make drugs of this category illegal and shut down not only use of them, but possession of them, and research on how they work and what they're used for are now Schedule I illegal drugs, even to research. And the early theories were that the mechanism of schizophrenia, or the delusions and hallucinations that people who are schizophrenic have, are very similar to what an experience of a normal person taking a psychedelic like LSD are. And it was proven otherwise, but it was thought to be the same mechanism, and it turns out not. However, these are very powerful tools that can change our consciousness for a defined period of time, like a day, and allow our defenses to go down, and our relationship and our communication with other people to become more relaxed. So if somebody is distressed, either suicidally depressed or having suffered a trauma and is trying to get over it, or has end-of-life cancer suffering and is in the process of dying, a single session with a single dose and a single day of the psychedelic, for example, psilocybin, and that person's fears go away, their ability to talk to their therapists and caregivers becomes enhanced, their ability to talk to our family and our friends about what's going to happen while I'm dying or when I die, my own experience of the separation of myself as alive and conscious to dead, those things melt together, and the ability to talk about it is facilitated, and a single exposure for most people who've been through this therapy is usually referenced among the top 5 most impactful experiences in their life, along with the birth of their child or getting married and so forth. And so basically in the Vietnam War, and Nixon made these things illegal. Reagan created the war on drugs, which has escalated for the intervening period. And recently we're trying to get at least the research turned back on so that we can experiment legally in a medically controlled circumstance how this can help people initially with PTSD, with suicidal depression, and end-of-life transition, and get those approved for FDA use in controlled circumstances. So I'm happy to answer any questions in any dimension about any of this.
So actually, if it's okay, I'm going to ask you the first couple, and then we'll dive in. So obviously, this is a really complicated topic because it spans from recreational use by college students or people at concerts all the way through to trying to really understand the benefits. In terms of top 2 or 3 areas that could have the biggest impact for people, what would you say they are, and then what would you say is going on?
Well, for getting FDA approval in terms of efficacy and safety, the number 1 target is psilocybin, which is the active ingredient in mushrooms, and the number 1 priority is suicidal depression, which is a problem with military veterans in that approximately 1 veteran per hour commits suicide, and what's not as widely known is more deployed military service people commit suicide in the field than are killed by enemy fire. So it's the leading cause of death in the military.
Really quick, just to put it in perspective, if you combine everybody who's died of cancer, heart disease, and and diabetes, it still doesn't add up to the number of people who commit suicide every year. So that's, if we can impact depression, we could do more than, and I know cancer is always seen as this big, like the holy grail of like, if we can solve that issue. But depression and suicidal depression is such a complex issue that if we can impact it even by a few percentage points, that's huge.
So a single session on a single day with a single dose can get somebody from a suicidally depressed state back to normal. Early evidence is indefinitely. And so this is something that is unambiguously a good thing. It's low risk, and it's something that affects a lot of people. And from a scientific point of view, it's unambiguous, the results. If they commit suicide, the experiment failed. If they didn't, for 3 to 5 years, the experiment succeeded. So there's no arguing about the science about it. There's no arguing about the safety of it. There's no arguing about the importance and scale of the problem. Having the military being supportive of this research is important to them, regardless of what the politics say. So it's the sort of the earliest target. Post-traumatic stress disorder.
If I may really add it. And to put it in perspective, there are treatments that affect what you call consciousness that are just electromagnetic. So there are ways that we can affect processes in the brain by using these things that I think they're called wands. Do you know about this? Or
There's lots of them.
that essentially it's used for people who have depressive states, and they do a series of sessions, and it's supposed to reduce chronic depression.
Talking about TMS, I think, right?
Yeah.
Transmagnetic stimulation.
So this is just a chemical approach rather than an
So
electromagnetic.
the most effective medical intervention for suicidal depression is ECT, electroconvulsive therapy, which is you anesthetize the person and you put pretty high voltage and give them seizures, and that's the treatment of last resort now. That's the state of the art now. And these transcranial magnetic stimulations or things like that are less effective.
Anyway, I'm going to open up to 2 questions, and then just because everybody has been sitting for so long, I want to give you guys some time to chat with each other. Who would like to ask a question or do a drug? And did you bring samples? Yes.
Yeah.
It's bigger than a bread box.
Yeah, exactly. No, I'm interested in very sympathetic to the topic, so thanks for talking about it. Hey, I just want to ask about one particular thing that you said, which was, you were talking about our relationship to psychoactive plants as possibly being differentiating for Homo sapiens or hominids or something from other primates.
Yeah.
I've heard a lot of different explanations for the differentiation, and I've never heard that one. Can
So
you
Terence
say a little bit more about
McKenna put forth this hypothesis. He calls it the stoned ape hypothesis, which and there's sort of related hypotheses that we have the receptors for these psychoactive compounds in our brains, and the transmitters are in the plants. Those people who chose to consume those plants or had the active in their brain were kind of tripping out when the tiger was attacking. They likely got eaten and are out of the gene pool. Those people who managed that evolutionary process bred with like-minded people to create more or less a species that was much more active in terms of allowing ourselves to go into altered states of consciousness, shared altered states of consciousness, and increased language use, increased socialization, choice of breeding partners who also had similar, and thus the evolution of the larger cortex and our brain and our diet and our culturation on a relatively rapid scale from an evolutionary point of view.
All right, last question? Yes, the maroon shirt.
Yet another brick.
Damn you guys.
In your experience, is the military supportive of this therapy?
Yes.
Unequivocally?
Yes,
Why so?
because one military veteran per hour, like while we've had dinner here, 3 veterans have committed suicide because of suicidal depression. In one dose, in one day, in one session, this can stop that. And while you spend $1 million training a military person out of high school, send them to Afghanistan, and typically within the first 100 days, they shoot themselves before they get shot by enemy fire. So it's $1 million wasted, a life lost, and that also can be stopped by one session in one day with one dose of.
Do you think they would be publicly supportive of it?
Yes.
Okay, I also wanted to give you guys a sense of when I read a brief bio of what Reese was up to a while back. Reese, another way of saying you figured out sound, right, on the internet is, has anybody ever connected a computer to the internet and they use like a blue cord? He invented it.
And so the way that he
let's so a lot of people have Nobel Prizes and a lot of people have Olympic medals, but only a handful of people have helped create the internet. Yeah.
So that's something used by over 1 billion people every day, continuously, 24 hours a day, and that too was illegal at the time I first was doing it, and that in the mid-'80s and before, the phone company owned all of the wires up to and including the phone. Wow. And when the phone companies were deregulated, the law changed that the wires in the building belonged to you, and the wires in the street belonged to them. And thus it became legal to use the wires in the building to do other things like run the computer network on them in addition to the phones. And so thus being trained in physics and not engineering, I didn't know that was impossible. So I just designed it that way and did it. It took another 10 years approximately to get it approved by the IEEE as IEEE standard, and now it's that blue wire that is known as Ethernet.
When did you know that it would go everywhere?
When did I know it could go everywhere? That it would go everywhere, or could?
That it would.
Well, I knew that it could long before it did.
Right.
But people who were trained in engineering at the time, like Bob Metcalfe, who invented the Ethernet protocol, he invented it as a bus that ran on triaxial cable, which is like TV wire, but with an extra shield, and in a straight line instead of a star topology as telephones run. And so that was thought to be safer for protecting the computers from static charges. And so I figured out a different way to remove the static charges from the wires before they got into the computer, and then just let the grounds between the computers float. And
Was it by
signals
rubbing
don't
your
work.
feet and touching something? That's what always works for me.
So I was lucky in that I also had cyclotrons and other high voltage, high power stuff at Berkeley, and so I had the unusual ability to test things at fields and power that most people don't have access to.
Wonderful. All right, ladies and gentlemen, let's give it. All right, so ladies and gentlemen, I hope you found that entertaining and enlightening. Please, you can talk about anything you want, turn to the people around you, chat, indulge, drink, and most importantly, let's give one more huge round of applause for Where's Winston?
We should thank John because he's been doing this for a while. It's really pretty innovative, and I've had great experiences interacting with him and this kind of thing. And I think it really is a special way to get to meet new people and think outside the box.
Thank you.
you.
I'm going to put Flow Rider back on, and but seriously, get up, go talk to people. Go turn to somebody you don't know and ask them about the last time they were the biggest loser.